At least that's what I suggest. Hello, everybody. Welcome.
With that voice.
I want welcome to CripChat Australia podcast on everything disability with
Thank you, everyone. I'm sorry, everyone. We just had a bit of an IT issue. Thank you, Jonathan, for introducing. Welcome back, David. But today with us, we have a very special guest among us, Eliza. Welcome, Eliza. How are you doing?
Good. Hello. Thank you so much for having me. I've heard great things about your podcast and I'm really excited to be here.
That's awesome. And
Liza,
also for the
what is
viewers.
your role?
Sorry, David. Go ahead, David.
Can we just asking Eliza, what's her role within disability and
Yeah.
what does she? So we can understand exactly what Eliza does.
Hey,
Yeah.
David, you're live. So sorry about that, Eliza. So Eliza, please, can you introduce yourself and what role do you play in the disability space?
Yeah, great. So yes, my name's Eliza Charlie and I'm from Melbourne, Australia, but I actually currently live in Italy. And I'm an actor and a writer. I've worked in film and television and theatre in Australia. But alongside that, I've actually lived for a long time, since 2009, with a disease called myalgic encephalomyelitis. And currently I'm not working because of that disease. I'm back in the throes of being very, very sick and it's been very difficult the last couple of years. But yes, I've worked in acting and filmmaking. I've also had a bit of an alter ego career in business consulting and marketing, partly because I could work from home or work flexibly. And that means I've done a lot of work for not-for-profits and social enterprises. But at the moment, my main thing in connection to the disability space is, I guess, I've been sick for almost 14 years, and it took me more than 10 years to actually realize that I was living with a disability. And I still feel like I have so much to learn from disability advocates and people who have gone before me and done such amazing work. But right now, and in the context of this pandemic in particular, I'm finding it really important to step up and try to speak up for people who are living with especially viral onset chronic disease like myalgic encephalomyelitis and like long COVID. So that's sort of how I've entered into this space, and I've started to do more writing and trying to share my story more to try and see if we can make better systems and pathways for a better quality of life for people, even while they're still sick. Let's just try to get around people and see if we can create better quality of life.
Yeah, of course. Thank you for sharing, Eliza. So, yeah, look, how has, your disease had an impact of you ever since the COVID's come about?
So when I was in 2009, before I acquired this disease, I was living a very, I suppose you'd call it a full life. I was very, very physically active. I was able to work full time, and I caught a virus and never fully recovered. And especially those first few years, I got to the point where the disease was progressing. I couldn't find appropriate medical care or treatment. In fact, I was given some inappropriate treatments that made me worse. And it got to the point where I was mostly bedbound and housebound, and very little options for trying to adapt to that or find a way through. Now I'm unique, not unique because there is a subtype of people with this disease where the disease can go into remission. And I did end up having some years where I wasn't as sick. I was able to work some more. I was able to retrain as an actor and go and work in films, which was lovely. But the disease has progressed again. And after a surgery I had 2 years ago, instantly from the surgery, the disease was back in quite a severe form. And I've been sick ever since. So it affects my life in that, well, look, I'll explain 6 months ago, because I've just been through a program at a long COVID clinic here in Europe. So I'm actually a little bit better and able to do a bit more now than I was. But 6 months ago, I couldn't get to the bathroom by myself. So I'd often have to crawl to the bathroom. I couldn't sit up for longer than about 60 seconds. So drinking and things was quite difficult, and I needed assistance. I had and I still have an oxygen machine that helps me to breathe that I take throughout the day. And 6 months ago, my partner, he would have to put the oxygen tube in my nose when I first wake up in the morning to try and help me be able to sit up enough to maybe have something to eat or something to drink. So it was very, very debilitating. And within that, I'd occasionally have a better day, but mostly it was a pretty difficult time, and I didn't have equipment or systems in place to support me. So my partner became my carer, and at the time I didn't have a wheelchair, I didn't have equipment that now I have that helps me to access life. And so that's been a real journey, but I've also been able to access some treatment recently that's helped me to improve. Yeah.
It's very debilitating.
What was that?
The actual disease, the actual infection that you have, it's very debilitating. What do you call it? Debilitating.
Debilitating. Yeah. It has received a lot of research. They don't understand the root cause and the root mechanism of the disease, but they do understand a lot of the puzzle pieces. We actually know a lot about this disease now. There's this myth out there that it's mysterious and unknown. We don't know how to help people necessarily to adapt to it very well yet, but we do know a lot about the disease, and it affects multiple systems in the body, mostly the neuroimmune systems. And even the name myalgic encephalomyelitis, the encephalomyelitis, I believe, means inflammation in the brain and the spinal cord. So a lot of systems in our body are affected by the brain and the spinal cord. But I also have problems in my body with my blood. Like I've got lots of little micro blood clots, and that causes issues with oxygen. And if your muscles can't get oxygen, they can't work properly. And there's a lot of issues as well with the mitochondria, which is the part of your cell that produces energy. My body doesn't produce energy in the way that some other people's bodies do. And if I try to make it produce too much energy, I can have very serious consequences and be very, very, very ill, very sick. So I'm still learning how to adapt to it, even after almost 14 years.
Hopefully more research is done. Sorry, David.
Is there a reason why you live in Italy? Will it be cheaper to live in Australia, or you'll have more? Is there more hope over there in Italy?
It's a great question. The answer is a little bit more romantic. I'm in Italy for love. So about 4 years ago, I was in a stage where the disease was milder, but I was starting to have a lot of problems with my immune system again in particular. But I was physically able to get around more at the time, and I took a trip to Europe. I'd actually just been through multiple years of a divorce, so it was sort of on a trip and just solo travel, which was very freeing to have been able to do that. But on that trip, I met a very lovely man who grew up in Italy. And so we started dating. And I was in the Melbourne lockdowns in 2020 and 2021. He was locked out of the country with the border closures. So we didn't see each other for almost a year and a half. But in 2021, I got permission to leave Australia to join him in Italy. So I'm here for love. But also, it has meant that I've been able to access better and different treatment options for my disease, and better and different support, because we actively neglect this disease in Australia, and it's not just about ignoring it. We actually in Australia still believe myths about the disease that are about 30, 40 years old, and push treatments that are harmful. And many people I know in Australia who have this disease can't access medical care at all. They can't get medicine, they can't get physiotherapy because doctors don't want to see them, or doctors say there's nothing they could do, or doctors say, if you don't do exactly what I say, you clearly don't want to get better with this disease. It's a real mess in Australia right now.
From what I understand, doctors have to say that because then if they can get sued later on. So they don't like to touch it.
Yeah. And I think it's becoming a problem.
So
a good point, David.
It's more of a risk for them to do it here. That's why they like to send them overseas to do it, because there's less chance of them to get sued over there.
Yeah, fair enough. Thank you for that, David. Moving on, thank you, Eliza, for sharing as well. Eliza, when have you experienced the indignity of invisibility discrimination when it comes to having ME, together with prolonged COVID-19?
Yeah, I think the thing I find difficult about this disease is I lived, especially in the years when it wasn't as severe, I lived with a lot of it in silence. And I thought that was a choice. Oh, I feel a little bit emotional talking about it. I thought that it was a choice to kind of deal with it in secret. But it was actually the result of the Australian medical system for 4 years telling me that it wasn't a neuroimmune disease, telling me that it was anxiety, which I didn't have. Clinically, I didn't have. Telling me that it was deconditioning because of not exercising enough, which before I got sick, I was an athlete. And in the years when the disease was in remission, I could run and exercise again, no problem. So there was, some limits on that. I never fully got back to normal, but they made me believe that this disease was about my behavior and around believing I was sick, as opposed to receiving help for being sick. And the result of that meant that I was kept quiet, and I didn't talk about what had happened to me, and I didn't talk about the disease. And they were successful in convincing me for several years that I wasn't sick. And so what happened then is that when I tried to ask for accommodations at part-time work, or tried to advocate for myself for things that I needed, I wasn't empowered to do that. And I usually got pushed into situations where I was either exposed to people who were really sick, and I'd catch every infection. This is even before the pandemic, or was forced to not take breaks at work, where taking breaks and pacing out my energy is really, really important. And so that was a huge challenge. But part of the challenge was that I didn't have the language, the words to understand my own disease. And so I couldn't talk about it, which meant I didn't get support. And that's probably, I think, one of the most difficult things. And as a result, whenever I did try to talk about it in any context, whether it was in private with a doctor, whether it was with a friend socially, or like with a family member at a Christmas party or something like that, or in the workplace, the people I spoke to had preconceived ideas about what the disease was, and usually would even if they had good intentions, would really deliver quite a lot of indignity. And I would, if, for example, if I said, I have this disease and it affects me in this way, they either deny it, say, no, you don't have that disease, based on no evidence, or they try to redefine it. They go, oh, that's the disease where you're just tired all the time. You're like, nope, that's not it either. Or they try to solve it. Oh, my friend's uncle's brother's sister took this particular type of tea and it cured them. Or they just sort of brush over it and move on, and there's no engagement with this huge thing that's going on in my life. So there are some exceptions to that. There are a few good people in my life, but the default setting for most people in most contexts in Australia is to deny the disease, to try and redefine it in some way, or to try and cure it. And I can tell you, if there was a cure, I would know about it. But also right now, cure is not necessarily my goal. I don't think my aim here is to become 100% cured so I can be this productive member of a capitalist society. My goal here is, how can we value people even if we don't have function? How can we value people even if we're not necessarily productive in the traditional sense, and still value having community and society instead of just economy? So that was a long answer, sorry. But yeah, I've been laughed at. I've been
sorry, Lola. Cutting it short, education is the key.
Absolutely. And there's been a very interesting study recently run by a group in the UK called Doctors with ME, which is what it sounds like. It is medical doctors who have this disease, so they really understand it. They ran a survey of medical education, and they realized that doctors and medical students who had not been taught about this disease actually had a better understanding than those who were taught about the disease. And that's because we're teaching the wrong things. So a doctor who has never heard about this disease is more likely to help you than a doctor who's been taught the wrong thing. And that's a big problem in Australia, including, it is now everywhere in Australia. Every guideline has incorrect and dangerous information, and that is now being transferred into guidelines for other viral onset chronic diseases like long COVID. The long COVID guides have the same misinformation, and it's gonna damage people. Yeah.
Yeah, no, thank you for sharing that. Thank you very much, very insightful. And I do apologize if it brought back any memories, but moving on to the next question. What sorts of complications would occur for a person like yourself who has ME when contacting prolonged COVID-19?
So am I understanding that means if I, as someone with ME, caught COVID and had long COVID, what would the complications be? Yeah.
Yes, sorry about that, yeah.
No, that's great. I think it's a really important question. I don't think the answer is clear and final, but my current understanding is this. ME is an umbrella term. People who have ME have lots of different initial causes, including different viruses. So it can look a little bit different. Some people from bacterial infections, and some people from non-infection onset. So, I mean, my relapse was from surgery, and there's other people who have the disease from surgeries and anesthetics, and from physical injuries, especially for neck and spine. But there's a whole lot of causes for the disease. But then the disease looks very, very similar. It has a very core set of symptoms that are consistent throughout the community. At the same time, we have long COVID, which is also an umbrella term for people who have ongoing symptoms and ongoing disease mechanisms in their body ever since contracting the virus. And it can look different. For some people, they've got lung damage, and that really affects their lungs and their breathing. For some people, it is more to do with like blood clots and strokes and having heart attacks and cardiovascular events afterwards. And then some people, most of the studies at the moment say it's about 50% of long COVID cases have a disease that looks very similar to ME. I'm not going to say it's exactly the same, but it looks very, very similar. So for someone like me who already has ME, if I was to also contract COVID, there is a high risk that it would make all of my symptoms worse. And in particular, it would probably affect my blood and my heart, I think, the most. And I actually had an adverse reaction, an injury from the vaccine. I am very pro-vaccine. Please, if you are healthy and able to be vaccinated, if your body and immune system can handle it, please be vaccinated. I think it's a great thing. But I had 2 doses and got worse with both. And now I'm not allowed to have any more because it would make me even sicker. And part of that is the way that my immune system, every time my immune system mounts a response, it causes a cascade of problems throughout the body that can last. And if they're not treated, it could just be the rest of my life. Now I'm very lucky. I found a doctor here in Europe, in Germany, that has, and one in Italy and one in Spain, who has been able to treat me and help me. So they've been able to help me deal with some of the symptoms. But I still live with this disease every day. And I'm still very cautious of COVID, and I wear a mask all the time.
It's better to be safe than sorry.
Absolutely.
So thank you. Thank you for sharing, Eliza. That's awesome. Moving on, how does the healthcare system usually respond to patients with ME who, I guess, also present with prolonged COVID-19?
What I'm seeing at the moment, I guess what I'm hearing from the ME community, but also people who I've connected with who have long COVID in Australia and overseas, we're seeing a repeat in how people with long COVID are being treated. We're seeing a repeat of how we treat people with ME. So setting aside the question for a moment on whether they're the same or not, there could be some key differences. We're still coming to understand where to draw the line. But the way we treat them in terms of the healthcare system has been very similar. And that's very worrying because it is both harmful and can have a lot of indignity. So at the moment, there's the long COVID parliamentary inquiry in Australia. People who have long COVID and clinicians and researchers can send in their stories and Parliament will read them. A great committee. I'm cautiously hopeful for this inquiry. And already in some of those submissions, which are publicly available online, we're seeing the same things that we're seeing in ME treatment, which is this. People are told that they're not sick, so they're denied that they're sick. They're told that it is just a bit of something. There's this like dismissive and minimization of it. People are told misinformation, so they're empowered with the wrong information. They're told to exercise and they're told to see a psychologist, as opposed to going to a cardiologist, an immunologist, a rheumatologist, a hematologist, and getting different tests. People are getting given basic tests, told that they're normal and therefore they're not sick. And at the same time, the person's like, but I lost my job, but I can't care for my kids, but my partner now wants to leave me because my doctor's told him that I'm making it up and I'm very, very sick. You know, there's all these things that can happen. And I think that over the next 10 years, if we don't get this right in treating people with dignity and research, proper evidence research-based information and treatments, if we don't do this, over the next 10 years, we are going to have more people who are experiencing domestic violence, more people who are homeless. We're going to be increased risk of cancer, heart disease, diabetes. This is a mass disabling event And I want us to develop systems that can really partner with people on this journey as they learn to adapt to this new disease and find what's appropriate for them. But at the moment, like we're seeing more and more in Australia, doctors putting on their website, they will not see patients with ME. Like, that just seems straight up discrimination to me. But yeah, so you'll get handballed around from doctor to doctor. Everyone says, that's not my job. I'm not there is no specialist for this disease. So everyone's like, that's not my job. I can't treat you. There aren't enough doctors who will treat you. And then if you can get an appointment, at best, they might tell you to rest, but more likely they'll tell you to exercise and do things that can be harmful. And then it all feeds into longer term systemic issues like with the NDIS. People getting denied access because they can't prove that the disease is stable and they can't prove that it's permanent. And even the NDIS telling people that they have to do graded exercise therapy before they can prove that they're eligible for the NDIS, when graded exercise therapy is known to harm patients. So it's a real mess right now. I'm hopeful about the inquiry. I'm just so sorry that people with long COVID are facing the same issue. Yeah. The issue of being denied and given the wrong treatment. Yeah.
Yeah, actually more research is done, like I mentioned before, into this disease. And also, look, everybody needs, access to supports and whatnot, especially with the NDIS. Look, systems need to improve, for sure. For sure.
And the other thing I'll say on the health system is that over the last decade, if I've needed a doctor for a different reason, so for example, if I've needed help from a gynecologist as a woman and person with uterus, or if I've needed, I had a lot of issues with my gut for a long time, I saw a gastroenterologist. It was safer for me to go into those situations and not tell them that I have this very serious disabling disease, because as soon as you say that, they dismiss everything. As soon as they know you have this disease, especially because in Australia, they still often refer to it as chronic fatigue syndrome, which is a problematic name. It's not the original name. It came out of the US in the 1970s and 80s. So yeah, it's really hard. Like even with my surgery, I had to try and tell my doctor, I'm like, look, I have this disease, but maybe it's not so much of a problem at the moment because I just needed him to perform this other surgery.
Sorry,
but then,
sorry, I had a bit of IT problems. I was going to ask you, does the NDIS actually follow you to Italy?
No, so I'm not on the NDIS. In my particular case, that's partly because I haven't found a way to be, I think, brave enough to apply. I just hear about how brutal the process is, but I have close friends who are on it. I don't believe that it would follow you if you're overseas, but I actually don't know. I'm not sure.
I'm pretty sure it does.
Yeah. So for me at the moment, I am crowdfunding all of my medical treatments. And if I had been in Australia for the last 6 months, I wouldn't be able to sit up and talk to you today. I am only here because I have had access to a long COVID and ME specific clinic in Germany and access to treatment that's been paid for by crowdfunding. I've spent 50,000 Australian dollars in the last 4 months on treatment, just so that I can sit up for a few hours a day. And I'm so grateful, and everyone who's donated has been it's been such a huge blessing, and people have learned about the disease while engaging with the crowdfunding campaign, which has been huge. I also felt a lot of shame with having to crowdfund and shame with having to ask people for money, but it is what it is. 2 years ago, I took 2 weeks off work to have a surgery, and I never went back. So yeah, and here I'm, it's cheaper for me here because I'm living with my partner. Yeah.
That's awesome. That's awesome. And if anyone wants to keep donating to Eliza, keep sending her your support.
But if you need the
Thank you
money
very
for
much.
your own treatment, keep your money for your own treatment and your own equipment if you need it. Just if you have like someone you know who doesn't need the money and wants to give, maybe ask them.
No worries. Thank you very much for that, Eliza. Eliza, what would be your advice to our policymakers on how, I guess, best to confront the challenges for people with the ME and CFS, also and prolonged COVID-19 in Australia?
The first thing is to listen to patients. And that goes from the micro level. When you are in the room with a patient, if you tell them your blood tests are normal, there's nothing wrong with you, and they're saying, actually, I'm really debilitated by these symptoms, my life is very affected, there is something wrong. There's a fantastic researcher overseas, he's Australian actually, I think his name's David Petrino. He tweeted a while ago, if there's not a specific biomarker that you can find, the patient is the biomarker. If the patient is telling you that they are sick, listen to them. So listening is important. On a bigger level for listening, things like the parliamentary inquiry into long COVID are very, very important. But also, it costs a lot of energy for us to submit to inquiries and submit reports and to over and over tell our traumatizing stories of being mocked and laughed at and spat on and denied pain relief and denied access to medicine, denied medical care, left bedridden, in our own filth, people who need feeding tubes, who are denied access to feeding tubes, all sorts of things. We've told these stories over and over again. They are documented in the NHMRC 2019 report. They are currently being documented with the Disability Royal Commission. We have told these stories over and over and over again. So part of listening is go back and read what's already been written. So if you're looking at graded exercise therapy, for example, there is a report done by Emerge Australia, the charity, from years ago, who surveyed patients and saw that 89% of patients were made worse by these graded increases to activity or exercise. 5% didn't have an effect and 5% improved. I can't imagine any other drug being on the shelf of a pharmacy that helped 5% of people and injured 89% of people that we wouldn't immediately pull that drug off the shelf. So listening is very important. And then the other thing is start to build connections and collaborations with patients and researchers so that there is an ongoing listening going on. So there are amazing researchers in this space. Melbourne has a campus for the Open Medicine Foundation, which is one of the most highly respected ME research communities in the world. They have 6 international campuses. One's in Melbourne. Let's interview them when we're writing media articles about ME and long COVID. No, it's independent, I believe. But there's researchers at La Trobe, there's researchers at Griffith, there's the National Neuroimmune Centre. These people exist, but we're not talking to them. We're talking to exercise physiologists who want to get paid to force people to exercise, even though it makes them worse. So let's talk to the people who actually know what it's like to live with it. Let's talk to people who actually know what it's like to research it. And let's start there. Let's start with actual evidence. Yeah.
That's awesome. That's awesome.
That's my advice. Because there are some treatments.
I think that's pretty good advice.
That's great advice, Eliza. You're a very amazing woman, Eliza. And thank you very much for spending an hour of your day to be here on our podcast. You know,
Thank you so much for having me.
Spreading awareness and give us an idea of what it's like to have ME.
If you want to share on our podcast your details, if someone wants to donate or anything, just put it in our comments. How to donate.
Oh yes, I'll do that now.
Thank you, David. Thank you, David. So yeah, for the audience out there, yeah, show us your support. Show Eliza your support. Donate. Get the money rolling in. And so she can get, I guess, more hours. But also, we hope that more support is being researched so that you can, live the life that you want.
Yeah. And as I said, I don't necessarily think that that looks like a cure necessarily, because I don't want to hold up some ideal that I have to be, I guess, a standard society's view of what's productive and functional. I don't think that's the goal here. The goal here is to have a better quality of life. The quality of life of ME has been measured in multiple studies and shown to be lower than people who have terminal cancer, who have MS, who have chronic heart disease. And the thing is, for too long, we've said that that's the case because we don't know. It's all mysterious. And actually, we do know enough to be doing better now. Do we know everything? No. Do we know what works for every patient? No. But do we know enough to be helping people today and not injuring them, stopping the harm and actually helping them? Yeah, we know enough to be doing that right now. And we need education systems to make it long term. But any doctor, any friend or family member could start today by reading from patients and charities and researchers and starting today with what we do know. It doesn't have to be this way. Yeah.
Now, awesome. Thank you very much for that, Eliza. For everyone, you've been watching CripChat, your weekly podcast on everything disability. Thank you once again, Eliza, for joining us. We hope we hear more from you.
Yeah, I'd love to.
Thank you, Eliza.
Thank you for having me. Bye.
You'll be on. Bye.